We are going to continue the theme of dry mouth, and I'd like to welcome Theresa Yao. Theresa is a speech pathologist with a clinical doctorate degree. She's a board-certified specialist in swallowing and swallowing disorders, and we have been happy to have her on the Stanford SLP team for over 3 years. She's the co-director of the Bay Area Swallowing Support Group, which is an online free support group for people with swallowing difficulties. And we are happy she's here today to provide updates on treatment strategies. Right, here's what everybody wants to know: how do I make this better, as well as future direction. So thank you, Theresa.
Thank you. Thank you so much. Thank you, Dr. Stummer. And my name is Theresa. Some of you may know me because I'm part of the Head Neck Oncology Speech and Swallowing Rehabilitation Program team. So Dr. Kramer just did a wonderful talk, give us an overview about dry mouth and why it happened. So I'm going to continue on talking about some treatment options and future directions. So in my clinic every day, I see lots of patients with head and neck cancer before, during, and after their treatment. Usually I will start my session with checking questions, ask how they're doing and how is their dry mouth and taste and pain. And the most frequent answer to my question about dry mouth is, yes, I still have dry mouth, or my mouth is still very, very dry. And the most question I got usually during the session is, will my saliva ever come back? And I just heard that question in the audience. So that's a great question, and that's what we wanted to take a look today. As Dr. Kramer mentioned, we produce a lot of saliva every day, like 1 to 2 liters. But with aging, our salivary flow usually will decrease. But with cancer treatment, specifically to the head neck area, it also affects our salivary flow. So there's 2 fancy terms that I wanted to point out here. You probably heard a lot during your treatment. One is hyposalivation, and this is an objective term of dry mouth. Basically, it's an objective measurable reduction in salivary flow. And then xerostomia is the one that we heard a lot as well, and it's a subjective sensation of having dry mouth. So sometimes we don't really measure patients' salivary flow that much. We just ask patients' feelings. So most of the time, I think we rely on their subjective sensation of dry mouth, and that is important. Even though some people may not have actual objective reduction in the salivary flow, they still can feel their mouth is really dry. So I think Dr. Kramer also mentioned, when you have radiation, when the saliva gland is in the radiation area, you will likely get irreversible saliva gland damage, and that occurs in high percentage of patients. And then among those patients, up to 40% can experience moderate to severe late xerostomia, meaning that years after radiation, you will still have this dry mouth issue. And as we know, dry mouth has been one of the top long-term radiation-related side effects that can impact quality of life. So dry mouth is not just about comfort of your mouth. It is also very important for our swallowing and eating experience, because dry mouth helps us with lubrication. And lubrication is a really key component to help us to ease the process of swallowing. With dry mouth, you may reduce the swallowing efficiency, meaning that you will probably have more effort when you're eating and chewing because you need to mix that food with your saliva. And then it can also cause issues like discomfort, maybe affect your taste change, and also difficulty swallowing, chewing, and as we mentioned, risk of dental disease. So what are the current dry mouth treatment options? I know many of you many of the patients and clinicians, we always want to have this like magic wand that can just help us to fix everything if we can. But do we have that now? Let's take a look. So the current treatment options falls into usually 4 different categories. So from prevention to behavior strategies to some medical therapies and also some integrative approaches. So prevention happens before the cancer treatment starts. And there's potential tissue sparing techniques that your radiation doctors can use, such as the IMRT, the intensity modulated radiation therapy is one of the techniques that they usually can use to try to spare that, to preserve that salivary gland function. And also, for certain patients, radiation doctors can consider reduce the dose to the specific salivary glands, like parotid glands or other salivary glands. But again, this is not for everyone, because if the tumor site is near or in your salivary gland, there's probably not possible to reduce that dose. So it is really determined by where your tumor is, and your radiation doctor will know what's the best techniques for you. And also before your treatment, you probably heard a term rehabilitation before. That's the process of regaining function after injury. But we usually talk about prehabilitation in our field. So prehabilitation meaning that you really do things before the injury happens. And what we do here, I think in a lot of clinics, that we do see patients ahead of time to provide education, counseling to them, and also materials, exercises, strategies to patients, just to let them know that, when the issue happens, what you can do to manage the symptoms. And of course, close follow-up with your radiation doctors, with your speech pathologist, during and after treatment can be helpful to manage the symptoms. So when we see patients, my role mostly is talking about behavior strategies. So usually the first session we see patients before the treatment, we will talk about, what kind of side effects you will get during the treatment, and these are the tips and tricks that you can use to help to improve to manage the function. So one of the things that I mentioned mostly is drinking water, because water is your best friend if you have dry mouth, and I have it here because I tend to have dry mouth when I talk a lot. So drinking plenty of water throughout the day and sipping water regularly is very, very helpful. I know some people just feel like, carrying a water with you is too much work, but just make it a habit. It can really help. Also, at the same time, try to limit your caffeine intake. Things like coffee, tea, energy drinks, and soft drinks. It's not asking you to completely get rid of your regular coffee, and that's hard, but just knowing that caffeine can dehydrate you, and if you drink too much, the dry mouth will be worse. And if you drink coffee, you can just add a little bit more water at the end, just to give you a little bit more hydration. Also, if you're eating, try to choose food that is moist, soft, that is easier for the process of swallowing and chewing. But if you have to eat some dry, hard food, make sure that you can mix them with some broth or soup, or if you have some sauce, gravy, mixed with yogurt or creams that help to moisten the food. And also sucking on sugarless candy or chewing on sugarless gum can also help you to stimulate that saliva production. I have a lot of patients telling me that overnight is the hardest time to deal with, because when they are sleeping, they probably will open their mouth a lot and it gets dry really quickly. So having a little humidifier next to your bed sometimes can help with the humidification overnight. And then some patients also will take some fresh papaya, because it has specific enzyme in it that may help you stimulate your saliva. And also some of my patients will try using coconut oil or some other palatable oils to just coat their mouth to make it more comfortable and stay moist longer. And also there's some tablets, lozenges called Xalomets, and that's available that you can like take it. It's like a one tablet. You can actually, it's adhesive, so you can stick it on your gum, and some patients use it overnight so that it can keep stimulate your saliva. So those are just some behavior strategies that we usually share with our patients, and I believe a lot of our patients actually develop their own strategies. And I think that's usually the best, because you know what works for you. And not all those strategies here work for everyone. I always tell my patients, explore things that works for you and then keep them if, you think they're helpful. And medical therapies can also help. We know that there are some prescription medications that is available on the market that sometimes our patients use, like these ones that listed here. Some of them are tablets or oral rinse, and you can take them and then they can help you to relieve your symptoms. And some of them are IV injection drugs that mostly you use it, I think, before or during your chemo and radiation treatment. The purpose is to help to protect that tissue, saliva gland or oral mucosa, to try to prevent that injury. So all these medical therapies, the prescription medications, you have to get it from your doctor. And also from all the research has shown that some of them may relieve your symptoms, but they're not curative. At least current evidence is limited on curing the whole dry mouth issue. And one thing that you also need to pay attention with any medication drugs is that there's side effects as well. So some of these drugs may cause you sweating or nausea or diarrhea. So if you are considering these medications, make sure you talk to your doctor to see if you are a good candidate for them. And then there's also, I think a lot of us heard of a saliva substitute and saliva stimulants. Most popular one, I think, among our patients is the biotin, and there's also BioExtra, Oasis, and there's also some prescribed substitutes. So these usually comes in different forms like sprays and gels or toothpaste and mouthwashes. So you can use them to help just basically substitute your saliva temporarily. Again, they're also usually not for long term. It's just temporary relief. Another medical therapy is a procedure that I see like some clinics are doing for certain patients is the submandibular gland transfer. It's basically try to move the submandibular gland towards the front, the submental space, like right underneath your chin. And then these type of techniques is done in some clinics, but it's only for specific patients that, if you know that once you move the saliva gland out of the radiation field, then it will improve, preserve that function. If for patients that the radiation field is going to involve the whole oral cavity, it's probably not worth it to move it because it's going to get radiation anyways. So that's why it's really for specific type of patients only. And with the integrative approaches, I think the talk earlier mentioned about acupuncture. So acupuncture can have a lot of benefits for pain, for dry mouth, because we think that it may influence the local blood flow near the salivary glands, and that can potentially increase the saliva gland production. But from the studies that's out there, there's literature review talking about using acupuncture in dry mouth treatment, mostly talking about they can improve your symptoms really well, but actually there's no objective improvement of salivary flow. There's also talking about Chinese herbal medicine, and you see this in some studies as well. And most of the studies are in nasopharyngeal cancer patients. And for this treatment, I think it's still with limited evidence. There's studies showing that there's improvement of symptoms, but not consistently. Okay, so those are the things that we have right now that's been discussed and studied in the literature, but we wanted to know what's down the road, what's future, and gene transfer therapy has been a new just type of treatment that's been studied in some research, and or talk about one that in currently ongoing trial. And then stem therapy, also cell therapy is also one of the new type of treatment that's talking about try to restoring the salivary gland function and regenerating the salivary tissue. It's been done in some preclinical trials, mostly with promising results, but there's still more study needed to be done in humans in clinical trials. And also sometimes we heard that using a transcutaneous electrical nerve stimulation, TINS, to help with stimulating the saliva function. And also that's still, more studies need to be done to see if it's actually effective. So definitely the future direction is we hope that, you all get your saliva back and back to normal. And that's definitely, like we said, we got to have a hope. But so these are the ongoing trials that you actually can check from the cancer.gov. There's more, probably more than the 3 that I listed here if you're interested in looking into. One is actually one of our radiation oncologists here, Dr. Lei. She is leading this D-Laminate trial on treating dry mouth with people undergoing chemo and radiation therapy. And then also the gene therapy that I mentioned earlier, there's a multicenter study trial going on investigating if this specific gene therapy, the AAV2, HAQP1, if it's effective on helping with restoring the salivary function. And also there's another one in University of Wisconsin-Madison is talking about transplanting bone marrow cells into salivary glands. And there's more on the website, so feel free to check it out. And some of them are not in the US. But definitely we have hope that, there's ongoing trials investigating these dry mouth issues. Lastly, besides the treatment, we always wanted to think about, support, because dry mouth is not just a symptom. It impacts your quality of life, impacting your family, yourself, your participation. So it is, if it's impacting your quality of life a lot and impacting your emotional or mental health, you feel like you wanted to just, go to support groups. There's support groups out there, there's counseling services out there, and also as speech language pathologists, we always, welcome, patients to reach out to us, and we can always provide strategies or resources to them. And also caregivers, they are, wonderful, they're critical for our patients' journey of cancer recovery. So they can actually help patients to see if they can remind them with strategies, remind them for hydration, and also I know a lot of caregivers are the ones that prepare the meals. So make sure that you can also find some adjustment for your meal preparation. And also, of course, emotional support is very important. And talking about support, I'm just going to add another flyer of our support group here. We are a support group for swallowing difficulties for cancer, for any patients that have swallowing issues. But we also talk a lot about dry mouth and other symptoms. And actually, one of our support group member, Barbara, is gonna talking about her journey and experience of dry mouth later after my talk. So they're very excited for that. So in general, we're going back to the question that we asked earlier, will my saliva ever come back? Well, right now, currently, we don't have existing treatment that can really cure the issue. And then also what we have right now, there's no one size fits all for sure. What we're looking at right now is really prevention and management. Those are the critical approaches we can use. But we should always have hope, like, we heard from Dawn, like there's hopefully more innovative approaches, options in the future for us. So that's the end of my talk. Thank you so much. And I'm excited to hear from Barbara, our support group members, share her experience.